MDNews Network recently attended the Medical Group Management Association's annual conference in New Orleans, where our cameras focused on attendees with opinions on everything from healthcare reform to healthcare technology. Here's what they had to say.
We've been on an electronic medical record for over 5 years now, and we've actively been using the product, and I think right now meaningful use is on the horizon. And so I think it's very important that if you're not on an EMR, you should actually get on an EHR, start using it so that you can be more proficient at it for the reporting period.
We've been on an electronic health record, in this case the Allscripts product, for almost 6 years now. We went live in a 3-week period, getting all roughly 75 providers, doctors and mid-levels up and running over that 3-week, 15-day time period. And it was a process that was not an easy selection process, but it was something that as a group we felt like we needed to do. We needed to be able to access or have better access to patient information, even to allow the physicians to have access from home or from the hospital or wherever they may be, wherever they have an internet connection. We've even had doctors on vacation in Hilton Head and other places that are accessing a patient's chart, so when they come back from vacation, they don't have a mound of charts to sign off.
With the adoption, obviously, it's about access to the information, and when you have multiple sites, it's very easy for physicians to communicate with one another so that they can talk about the same patient, sharing the same information. From a patient care standpoint, we're a multi-specialty group, so it allows me to consult with my consultants that may not be on the same premise and talk about the patient, share that information, and hopefully in the future we'll be able to share that with consultants or specialists that aren't exactly in our group, and we can share that information back and forth, and that's ultimately through the HIE, and we want to get to that point.
Well, now that we've been on it for 6 years, we've got physicians that in no way, shape, or form would they ever go back to practicing with paper charts. They're very upset if for some reason we're doing maintenance or something hinders their ability to access the system. If they have a equipment malfunction, their PC goes down or their tablet goes down, it impacts their ability to work that day. The other side of it is better patient care, because I believe when you have changes that occur, whether it's a drug recall or some other life safety issue, that you can quickly access the number of patients you have on a particular drug or a particular treatment methodology that may not be approved anymore, where in the past it would be impossible to develop that list of patients to communicate with them about, we need to get you off of this med and get you on something else. Now in a matter of minutes we can have that list to facilitate communication with pharmacies, with other physicians through the carbon copy features and things, to where our specialists getting patients from one practice and being able to send that note back to them electronically is again a huge feature, and it facilitates communication in a much more timely manner. They're not having to wait for the letter to be written and signed. Once they electronically sign it, it goes electronically. So those are all advantages that we've seen that I think have really hit upon patient care that the physicians, I don't think, thought about when we were considering this, but they're finding them as ancillary benefits.
Obviously, change is something that people don't embrace too easily, but it is the way to go. It's about the patient, and that's what this is all about. You can feel like it's pressured, but that may be the nudge that someone needs to go in that direction. But I think that this is getting to the patient care, quality of care that we're all striving for. So this is the infrastructure, the foundation for that.
There were a lot of hurdles that they considered. The largest one that I saw is it was going to slow us down. And as a result, our productivity was going to go down, our compensation would thus fall. But it became very evident as we were going through the product selection that we needed to find something, and develop a methodology that would allow our physicians to continue to see the same number of patients during that phase when they're learning the system, they're learning how to use it and how to implement it within their practice. We were able to develop that with a modular adaptation and go through again where during that first week that physicians were live, we'd frozen their schedules so that they would not get overloaded. After about a day and a half, they're looking at us and saying, just open my schedule back up. This isn't as bad as it's going to be, and we really had no decrease in productivity at all.
It's choosing a vendor that actually has a vision that you know is going to be around for the years down the road. We've been in practice for over 60 years now, and I'd want to partner up with a vendor that's going to be around. So you always want to have a vendor that has vision, leadership.
We had a committee of our physicians that went out and evaluated products, that looked at ways to implement it, and then once we made the decision to move forward, we had physician champions that were involved in the implementation process and really helped develop the mindset that we're going to do this, that you have to participate, you have to be involved, you have to do it this way. And I've heard horror stories at other practices where a physician, passive aggressive or however you want to describe it, just says, well, I'm not going to use it, I'm not going to do it. And we had none of that in our group. We had, again, very strong acceptance once they made the decision to move forward that, okay, we're going to go ahead and do this, and we're going to make it as good as we can.
Waiting is something that, it's going to pass you by. Right now, I think if you haven't looked or decided to go with a vendor, that's a process that needs to be started as soon as possible. Clearly, you shouldn't rush into it. Nowadays, there's umpteen different vendors that are out there, and you need to be very selective to find one vendor that is going to be with you through thick and thin, the one that's going to be with you for your future, the one that's going to meet the meaningful use requirements. You want to be very selective about that, and it's one of the key decisions you'll ever make in your practice and in your career. Once you've selected, that's one process. Implementation is the next big hurdle, and you really need a strong physician champion, the one that's going to take the slings and the arrows, that's going to push your organization through thick and thin to get you to the next level, because getting an EMR is one thing, but using it is the whole other process. So it's a physician champion is key. It's a nudge in the right direction. It's about the patient care. It's about quality of care. And those two things are driving forces that all physicians, embody. And I think that, you come to a conference like this to see how you can do that better, what your partners you're in healthcare are doing also. And so you want to make sure that you learn from them, they learn from you, and you move forward.
Now that you've heard what the MGMA conference attendees have to say, we want to know what you think. Click on Share Your Perspective at mdnews.com to let us know.